Sarah Mitchell wants to know when the 2010 final data will be out, not just the preliminary data.
Great question, Sarah. I don't have the answer to it. I would just advise checking back. This is about the time of year that they put online the final data sets for both utilization data and the financial data, which is sort of the companion piece. So I would check back regularly or call David Burns at OSHPD, who may be able to give you a better idea. But we're right in the season where it should be put up there.
And then Karen Karp says she's interested in hospital manpower, but the data doesn't include all hospital positions, such as various mid-level providers. And she asked, is there a way to suggest to OSHPD additional data categories for the annual database?
Well, sure, you can suggest anything that you want to OSHPD, Karen, although I would say that OSHPD right now, because it is so strapped for funding, is probably unlikely to be adding information at the request of reporters. I think you will find, though, when you go to the financial data, which is not what we're covering today, but the financial data does include information about providers at the facility and staffing levels, particularly as it relates to nurses. So you may want to take a look at that. It may have some of the information you're looking for, and some of the steps today in terms of how you download it and how you look at the pivot profiles directly apply to the financial information as well. And you can find that again by going to the main hospital data reports page, going to data, and instead of clicking on the utilization information, you want the financial information. And you can again see the pivot profiles, and you can pull those down. And so that would be a good place to start for information on staffing levels, which would be different from the data we're discussing today.
And we have a question from Mark Zochi. I hope I'm pronouncing his last name right. Really good question, which is, when comparing data from different hospitals, what are some ways to account for different patient characteristics that may account for some of the differences, such as illness, severity, payer, and so forth?
So that is a really good question, and this is not adjusted at all. So as opposed to the data that you would find, for instance, in the OSHPD reports about heart attack quality of facilities and their mortality rates, which are adjusted based on patient characteristics, this is pretty raw data about the number of services they provide. And so this would not be risk adjusted. And a hospital may tell you, this is just to let you know sort of the use of services at their facility. So this wouldn't tell you whether it's appropriate uses or not. It's just the uses of the information. And so if you're looking at C-section rates, certainly the characteristics of patients will play a role in that. But that will not account for, and many reports have been done, including in California, about the huge swing in the C-section rates at various California hospitals, from 10% all the way up to probably 50%. Those are really good questions, but it's first important to know where your hospital it stands in order to ask those questions. So I think this gives you the resources that you have to then begin asking questions of your hospital, of experts in the community, of the state hospital association. This gives you sort of the raw materials that you can turn to ask those basic questions to begin with.
And Charlie, as a follow-up, presumably if there's something that could be potentially negative in this data that is unadjusted, a hospital will have a story that explains it. How do you then check that? What kinds of experts do you seek to bounce those responses off of to get some perspective?
That's a really good question as well. So this data, again, this is not really intended to if you see something negative in the data. So the types of negative things that you would see here, for instance, what Christina wrote about the huge level of hospital admissions at one particular hospital chain, or an immense use of stenting procedures in certain communities. And for those, I think you need to first hear what the hospitals say. Some hospitals are forthright and say, we similarly have identified a pattern of overuse of a particular service, or we've identified that we're performing too many C-sections, and here's what we're doing to bring our rates down. But to get that more global perspective, there are a number of quality researchers across the country who have put in place institutes that help take this into account. And so, for instance, you could call a specialty society like the American College of OB-GYN in order to get a view from them. They're called ACOG, which would, their perspective about C-section use in hospitals and their recommendations, and see if you can run something by one of their experts. That's one view, certainly. You can also, check with some of the schools of public health, which have very good programs that deal with health quality. Some of the best are at Berkeley and Stanford. There's great programs also at UCLA where they can help you take this information and put it in context and draw the appropriate conclusions from it. So I would say, caution you against drawing the conclusions yourself. You can statistically sort of identify things that you would like to ask more questions about, but I would hate to see you in the position where you're drawing the reasons that this happened or didn't happen, or whether the hospital's reasons are legitimate or not.
So I don't see any other questions. Last chance here for anybody to raise their hand before Charlie continues to explore this data for us. Okay, I don't see any more hands. And just keep in mind, you can either raise your hand, or once Charlie starts going to another area, I suggest you, click on the question icon and ask a question. And so if there's an appropriate moment, I can just let him know that something is puzzling. And actually, I see a question from John D. Sorry, one more question. How do you get from the pivot selection page after making a choice like county to get data to populate?
Sure. Okay, so let's go back to the pivot selection page. That's at the bottom of your screen. You would click pivot selection page. First, you want to make sure that everything is sort of set to the way it was when you got it, because if it's not, you may compound your mistake by adding something on top of it. So if I had, for instance, had teaching hospitals checked to the yes position, and then I selected something else, it would only give me, say, teaching hospitals in Los Angeles County instead of all hospitals. So that can be a source of mistakes. So let's say you want to pick a county here, and let's say Contra Costa County. You can also select multiple counties if you're interested, and to do that, you would check this box that says select multiple items, and that lets you check however many you want, and it will pull that whole grouping up afterward. But I'm going to uncheck those and just say I want to check Contra Costa County and hit OK, and you'll see it will show up County of Hospital, Contra Costa County. At the bottom of the screen, you would go back to Profile Summary page. When you look at the top of it, you'll see that you're dealing with 10 hospitals in Contra Costa County. And if you want to see what those hospitals are, you would go to the bottom of the page, retrieve facility names, and there are the names of the facilities that you would see there. Johnny, hoping that makes sense. And if it doesn't, raise
John D,
your hand.
John D, I'm unmuting you so you can speak now. Does that make sense? John D? I'm going to assume that silence means yes. That makes complete sense, and I am now with you.
Okay. Well, if anybody else has a question about how we did that, feel free to chime in, and we can go through that one more time.
Okay. So why don't you go back to continue, Charlie?
Okay.
And just a reminder to everybody that you can tweet this if you want to at hashtag OSHPD.
Okay. So just going back to the report, I wanted to show you the tab that related to putting in cardiac stents, because this is an area that has gotten quite a bit of coverage about potential overuse of stents. And being in California, everybody is familiar with what happened in Reading, which didn't involve stents, but involved heart surgery. And so California certainly has a history of unnecessary heart procedures, and it's the job of reporters to, if we can, to spot those and raise questions about them. So back on this report, I'm interested in knowing the hospitals that performed angioplasty with stents, which is section 5, line 72. So I'm going to go back to the broad database, and I want to sort this by section 5, line 72, which is this category, PTCA angioplasty with stent. So I'm going to highlight all the data, and again, you would do this by clicking up here at the triangle that highlights all of the data, and I'm going to sort this, again, data, sort. And in your drop-down, I'm interested in the PTCA angioplasty with stent, largest to smallest, and then I'm going to tell it to go. And this shows you here that Kaiser Hospital, the Kaiser Hospital in San Francisco performed the most procedures with stents, 3,312. But interestingly, I was a little bit taken aback by seeing the St. Bernardine Medical Center, I believe it's in the Inland Empire, if I'm not mistaken. Let's just we can check that, but that they were second. That seemed to be a high number for a hospital that wouldn't be among the very largest in the state. So I would check that. Similarly, for Kauai Delta Medical Center, why it is that they're performing so many stenting procedures. For me, that's a flag. I wouldn't even necessarily say it is a red flag, but it's a flag that if you're looking at use of medical services, I would be interested in understanding why that would be. One thing you can do, and I think is important to do, is that it's important to not just take a snapshot of a facility in 1 year. It's always useful to look at trends. And so to do that, you would want to go back and download the data for previous years. And that will help you understand variations over time, whether that's in the number of C-sections performed or the number of patients who leave emergency rooms without being seen. Those are things that you can do by looking at year over year, and I would encourage you to do that because that can give you a much more complete picture than just looking at one snapshot in time. I want to show you one other thing as well, and that's on this checklist. After they go through the information on the services, there's a page that deals with new hospital diagnostic or therapeutic equipment that was more than $500,000. And here's where they will tell you what they bought, when they bought it, and whether it was purchased or leased or other, and the value of that equipment. So by going back to that large Uber table and then going down here, that's in this line here, this equipment purchase description. And here's where you can see, for instance, which hospitals bought the Da Vinci robot in 2009 and how much they paid for it. You can expect that if a hospital buys the Da Vinci robot, that they're going to use the Da Vinci robot, and that just because a hospital is telling you that they are getting the latest and greatest in equipment, there's a whole body of research to suggest that some of this is not necessarily needed in the communities in which it's being purchased. And it's good to ask questions about whether or not yet another hospital needs a Da Vinci robot or a CT64 slice scanner. And that these are questions that, looking at this, you can see which hospitals are buying it, and you can ask questions and write stories that are based on this information. So that's really useful. Now you can't, it's not possible to select a range of years and use that for your sort, because when you go back to the ASHPED site, you'll see that each of the years, just going back to the, sort of taking us back to the home, each of the years in the utilization data will be in a different database. So you'll have to do this in each of those years to get the relevant pieces of data. And again, you should start with the report form and instructions, because the category number or name or the question may be different in different years. So making sure that you're looking at this and that it's directly comparable. As a reminder, this is information that the hospitals themselves are submitting to the state. So it is quite possible, and it's happened to me before, that the hospital may tell you later this is incorrect information. Your retort to that should be that this is information that they provided. So you certainly should be interested in hearing what they have to say, but they supplied this information themselves. This is not information that the state came up with for them. But I would definitely encourage you to take a look at what the new equipment that hospitals are buying is, how much that equipment costs, and what they're using it for, and seeing if that's leading to, as you talk to insurance companies and as you talk to physicians, if it's leading to additional services being performed for patients. And I'm hoping that makes sense. So I wanted to show you how you can use this data to perform some simple calculations that would let you put some of this information in context, as opposed to simply just having one slice of information. So for instance, the C-section rates is one of those areas where it's great to know the number of C-sections, and it's great to know the total number of births, but if you're interested in knowing the number of C-sections over the total number of births, you would need to do some calculations. And so we'll do some of those calculations now so that you can see how that would look.